Good morning. It's 10:10 and we're going to get started in a minute. So we're going to talk a little bit about climate and health, and I invite you to take a seat if you want. So my name is Joanne Leovy. I'm a CCL Las Vegas, Nevada group leader and Nevada State Co-Coordinator. And in my other life, I'm a family doctor, and I'm interested in bringing a message about health and climate to people. And I know we got at least, I think, one in this room who's a active or retired or aspiring employee or worker in the healthcare sector or health professional. Yeah. So I think that in terms of Logan's super eloquent talk that we just heard, that thinking about messaging climate change as a health problem is a super useful framework for us in our work with grassroots outreach with members of the public, with grass tops engagement, and with lobbying our elected leaders and members of Congress. And there are a few reasons why I think this is really important. One is that there are healthcare members in all of our chapters, and it is useful for us to engage them. One of the reasons for that is that even coming out of this thing we had called COVID-19, healthcare workers are among the most trusted messengers that we have. And if you can engage people in the health sector to message health impacts of climate, you can build trust across lines. So nurses are still the most trusted profession in the United States, followed by pharmacists and a little more at a distance by doctors. We still have credibility in the eyes of people, and in particular, when conservative Republicans are surveyed about who they would like to hear climate-related messaging from, their personal physician is the #1 choice of conservative Republicans. So health can be a depolarizing message that can have credibility across lines of party and politics. And the reason for that is just like we all want a healthy earth and we want to leave a healthy planet for our children and grandchildren, everybody's concerned about our personal health. We all want good health for ourselves and our family and our communities. So trust is one really important message. I think another reason why engaging healthcare workers and health professionals to talk about climate change is that we tend to learn to communicate. And when Logan was speaking, I thought about a parallel in my own life. You know, I'm a primary care doctor, and I spend a lot of my day treating chronic diseases like diabetes. So when I tell a new patient, you have diabetes, I tend to get one of two responses. One is the disaster catastrophe responses, which is, oh my goodness, I have diabetes. I'm going to get my leg amputated. I'm going to go blind. I'm going to have kidney failure. So that's the catastrophizing response. And the other one is, I feel fine. You're telling me about a number, and why should I care? And our job as health professionals is to learn to walk that line of creating urgency and opportunity at the same time. So we're already trained as messengers in a way that CCL trains us to talk about climate, and we can translate our health messaging to climate. And a third reason, of course, is that, as we all know, climate change is in and of itself a human health problem on so many levels, like Logan was messaging. And we have an opportunity to talk about benefits to health of taking actions in a way that doesn't even have to mention climate change. So I'll give you a couple examples. One, if we electrify our homes and have clean and energy efficient homes, not only do we reduce greenhouse gas emissions a little bit, but we can stop having toxins like benzene from gas-fired stoves inside our homes, and we can all have clean and efficient homes that allow people to be able to afford their AC, keep themselves cool in times of heat, and protect our electric grid so that we don't have brownouts and blackouts, which are difficult. Or another possible message, if we can all learn about healthy eating with mostly plants and mostly foods that are unprocessed and wholesome, we can be much healthier, but also those same foods can reduce greenhouse gas emissions a little bit. Air pollution. Air pollution is a serious harm to health in all sorts of ways. It affects heart disease, it affects lung disease, it affects neurological diseases like learning in children and memory and dementia in older adults. We don't even have to talk about climate change. If we reduce air pollution by electrifying our vehicles and our power systems, we can make ourselves healthier right in our own communities. We can reduce diseases and we can save money at the same time and reduce greenhouse gas emissions. So health messaging is a really powerful form of climate messaging, and engaging health professionals is a really useful way to do that. And for anybody who's interested in doing Grasstop's outreach work to health systems or health sectors, engaging health professionals is very important in doing that. And so I encourage people to look for health professionals in their chapters who may not be super involved, but may be available to learn about this and to help us in ways with our messaging. And one of the ways that health professionals often identify is they identify in their places of work, in their clinics and hospitals and other health facilities where they work, and they engage in a way that is work-centered. And so as I began to learn about climate and health, I started learning a little bit about what does it look like to make the health system more sustainable. One of the issues is that the health sector is such a large part of our economy, about, I think, 19% of GDP, that health emissions are at least 8.5% of total emissions in the US. We're taught, for example, I as a doctor am taught my first credo is first do no harm, and yet the work that I do is producing emissions that cause health harms, and these health harms are so large they're on a parallel with death from medical error and illness from medical error. They're huge. And as health professionals and health systems start to realize this, there's an impetus to learn to become more sustainable in our own places of work. And so what I found was interesting as I started to work in this sector is that in CCL, we learn a lot about large-scale policy and about legislative policy and governmental policy, but we don't really look much into the nitty-gritty about what does it actually mean to decarbonize or reduce emissions in an industry or a company or a business or a segment in the economy? What does it really look like at a granular level to have that happen? And I started learning things like about scope 1, 2, and 3 emissions, which we've heard referred to a little bit this weekend. And I thought it's useful to look at the health sector as an example of how to understand what translating large legislative policy into on-the-ground work really looks like. So I hope that we'll have some information about engaging health professionals and about what does it look like to decarbonize an industry using the University of Utah health system as an example. So I want to introduce our two wonderful guests. We have Lissa Larson. She's the Associate Director of Sustainability and Energy at the University of Utah. Her team focuses on metering, utility billing, and tracking the university's progress toward carbon neutral by 2040. The sustainability and energy team uses their expertise to execute energy efficiency projects on campus and to collaborate with partners on operational improvements via a process called Seed to Soil, which is funded by an internal revolving sustainability fund. In her spare time, Lissa enjoys learning languages and working on a never-ending kitchen renovation. And we have Robert Armstrong. He was raised in the Salt Lake area where he grew to love Utah for its diverse geologic beauty and recreational opportunities. He has a bachelor's in geoscience and a master's in environmental science with sustainability emphasis from the University of Utah. And now he works at the Facilities Maintenance Department for University of Utah Health. For the past 9 years, he's the Energy and Sustainability Coordinator. He manages projects focused on improving building efficiency with lighting and HVAC as areas of focus. So welcome to you both. Thank you so much for taking the time to be here. And I'm going to turn it over to Lissa first.
All the mics play happily today. Hello. Oh, okay, cool. Strong start. Okay, so Robert and I are going to pass things back and forth a little bit. I'm going to start with some of the background on saying main campus here at the University of Utah, down the way at the University of Utah. So I work for main campus or the university itself. Robert works for the healthcare side, kind of up the hill a little bit. So our areas do overlap. I'll be talking about the commitments, what we mean when we say carbon neutral, and kind of understanding the value. And when we ask politicians, leaders, or executives, even in healthcare, hey, I want you to do something, what is that something? And how do we have a commitment that's actually actionable and understand what we have asked somebody to do? And then Robert will be able to speak to his experience on the U Health side and what we are actually doing to get there of being carbon neutral using the steps of right sizing via energy efficiency, sourcing renewables, and the role of offsets. So let's start with healthcare and why including U Health is important to us. So at the University of Utah, the U Health campus is pretty integrated into main campus itself. So you can see I have them boxed off in red. We have U Health buildings kind of adjacent to main campus as well as in Research Park and being part of it. These buildings have always been included in our footprint because we source their electricity and natural gas. So when we're just saying operationally, how much carbon are they using? We buy their electricity, we buy their natural gas, so we've always included them. This year, we've actually been working on a pretty big effort to also include all these offsite locations. So the clinics, and I'm very sorry for the tiny font on the side, but talking about South Jordan, talking about Sugar House, talking about Farmington, and including those offsite clinics so we can be more holistic when we talk about the U and our progress to carbon neutrality, as well so we can kind of share those best practices and communicate better. So why healthcare? Partially because it's right there, and partially because we are under the same leadership as part of 1U. Another part of this, healthcare has unique challenges. So talking about healthcare's percentage of the carbon footprint and its percentage of the GDP, healthcare is very energy intensive. So we're looking here at actual energy use intensity. So that is like energy, natural gas, and electricity usage per square foot by different property types. So these are the use actual numbers. Healthcare, you can see at 238, we also have lab space, and that's going to be split between like main campus operations, research for undergraduate students, graduate students, and then there's also some healthcare research space in those numbers. You can look at how energy intense that is compared to, for example, dorms or library or office spaces. So when we talk about how big of an area this is on campus and how much energy it is using per square footage, it's a lot of energy use, but it's also a lot of potential. At the U, this is between 20 and 25% of the U's total emissions is actually our U Health system. So this working relationship between main campus and the hospital, our teams, mine and Robert's specifically, is really pivotal if we are going to achieve our climate commitments. So now we get to the fun part of commitments. And this is a little bit the policy side of this weekend for everybody. So we have a few commitments. I'm going to start with really two that we're going to be talking about today. So the first one is one that University of Utah main campus has made, and that is the President's Climate Leadership Commitment. U Health also has the Health and Human Services Climate Pledge. Both of those are supported by our climate action plan, which has recently been updated since 2010. And that calls out mitigation. So saying, hey, we're going to be carbon neutral, reinforcing these commitments we already have, as well as goals surrounding resilience, education, and research. So when we talk about what we're doing, what we're actually holding our leadership accountable to is these commitments that they've already publicly made. And so this is where we're going to start talking about what is the commitment, what are we asking people to do, and how does the work that we do reinforce them. I apologize, but this is the nitty-gritty of when you ask somebody to be more sustainable, what does that mean? Usually that is signing a commitment and understanding what the commitment meant. So you guys talked a little bit about scope 1 and scope 2 emissions. We're going to talk about that more this morning. So the president's leadership climate commitment, whenever the EU talks about we're going to be carbon neutral by 2040, a lot of the academic spaces, when they talk about their carbon neutral commitments, it's this commitment specifically. So they're saying all their scope 1 emissions, which is what they directly burn on campus, so their natural gas usage. Scope 2 emissions, well, natural gas, refrigerants, campus vehicles. Scope 2 is all their purchased energy. So that's electricity, steam, chilled water, hot water, those emissions. So what it takes to operate their buildings is really considered scope 1 and scope 2. Scope 3, President's leadership climate commitment specifically calls out air travel paid for and by the institution and regular commuting to and from campus. And so that's including your students, your staff, and that includes UHealth employees for us. That doesn't include the patients or visitors to campus. But I'm going to call this out because offsets is a pretty dirty word in a lot of these conversations. If you have one of these commitments, and if you're talking about commuting, I can't force every single person to be in an electric vehicle. Also, there would have really big equity consequences to that kind of action. So you need to, kind of come to terms and think about offset policies that you are including some emissions that you can't control, but how can you have responsibility and still enable people to make good decisions in those environments? So that would be the first. The main campus is the president's leadership climate commitment. Originally, it was carbon neutral by 2050. President Randall in 2022 said, we're going to do it by 2040 and accelerated the goal. When we talk on the healthcare side, there's the Health and Human Services Climate Pledge that is kind of driving those actions and really mirrors the president's leadership climate commitment, but this is healthcare specific. So theirs is reducing organizational emissions by 50% by 2030 and then achieving net zero by 2050. So since UHealth is covered by main campus and we're going to be net zero by 2040, you meet the 2050 goal inherently and then just really need to focus on that 50%. When we're talking about these commitments, they're kind of the framework and a North Star in terms of how operational decisions are being made. Pushing towards sustainable on its own isn't necessarily actionable. It's effectively telling somebody, do better. It's like, well, do better how? Do better what? So talking about the goal of the commitments and the resources that these commitments bring, their websites, the resources that they develop, conferences like this is really useful. And it gives a way to hold ourselves and our leadership accountable and giving that framework so we can build our good efforts on it. Okay, so my 2 parts of background to start were why healthcare? And then it was what are our commitments that we're using to get there? The next bit is going to be carbon neutral and what do we mean when we talk about carbon neutral and that definition. So it's kind of the where in healthcare, the why of our commitments, and now the what. I'll give a little spoiler. Robert's going to talk about the how when he talks about individual projects. How are we getting towards carbon neutral? So this is the background messy side again. We talked about those scope 1, scope 2, and scope 3 emissions. There is actually in that commitment this big thing down at the bottom saying, hey, you are only including these scope 3 emissions, but if we ever figure out how to calculate all these other emissions, you have to include those in the future. We just have to have a mutually agreed upon calculation method. So we talk about these first categories, but that's the fun part about the commitments. As our technology gets better, as our accounting practices for carbon gets better, the commitments can change and evolve and ask you to do even more than you originally signed up for, which is arguably a good thing. So for the scope 1 and scope 2, scope 3, I think this graph representation really helps. So scope 1, you can see in the middle, company facilities and company vehicles. It's your direct operations. So we're talking about what refrigerants do you use in your HVAC systems? What vehicles do you own? Buses, what are you getting around? How much fuel are they using? How much natural gas are your buildings burning? How much backup diesel are your generators burning in their testing? Those are your scope 1 direct emissions. Pretty much everybody is including those. Scope 2 is how much electricity are you purchasing? That's where we're factoring in, what is Rocky Mountain Power doing? Are they getting greener? Do we have other offsite things that so for us, it's a PPA. I'll get into that in a little bit, where we are sourcing renewable electricity with Rocky Mountain Power's help, but we are greening our own grid faster than they are greening theirs. So that is the scope 2. Scope 3, when I said, hey, if those accounting methods get better, maybe we'll include those in the future. Scope 3, you can see all those unhighlighted things where we're talking about end of life for everything you purchase. What is your entire material procurement strategy? Is there waste in the upstream operations and the downstream operations? How do you factor those in? Because those accounting methods aren't quite established yet, they aren't included in every commitment. And it's a huge difference when you hear people talk about carbon neutral. It can be a distinguishing feature saying, are you including scope 3? What scope 3 are you including? Because it changes the kind of magnitude of the conversation. I also want to acknowledge, I think it's part of your green health commitment, maybe it is part of Health and Human Services, that you had to do a full scope 3 inventory for the hospital. What, do you remember which one that was covered under? I think it might be Health and Human Services Climate Pledge, where they had to go through all the products that they purchase and develop a scope 3 inventory of saying, hey, this is the carbon footprint of everything the hospital uses. So it's a pretty big deal. Yeah. Mm-hmm. No. So the definition that you can use for those leased properties is either, do you have operational control or do you have financial control? So we use operational in saying, can we make those energy efficient, or can we make those energy systems better? And if we are directly purchasing the electricity, if we can make changes to the HVAC system, if we can make the building more efficient, then it is our emissions to own. If it is a property in which we are leasing that we cannot make any of those changes, we aren't allowed to. So like, this is where research park areas for us get tricky from a main campus perspective, not necessarily healthcare. Like, if I cannot improve the problem, then it's probably not part of my footprint. But if I have ownership, if I improve the systems, if I'm doing all the maintenance, then it is.
So Lisa, I think what you're saying is that to focus in on scope 3, it's actually about 80% of the total emissions in healthcare. And that includes everything that gets bought and used. So food in a hospital, gloves and gowns, medical equipment, the MRI machine that has to be produced, used, and then when it's all done at the end of its life, it has to be disposed of in a nutshell. And that's something I think that we don't necessarily think about from a policy and legislative standpoint all the time.
Well, and that's because those accounting methods aren't widely agreed upon, that a lot of people are not including those. And so I point that out as a distinction for when you're having conversation with people. It is really important to say, are you talking about waste? Are you talking about full scope 3? Or are you talking about partial? The leased operations, people will sometimes consider scope 3 and sometimes consider scope 1. So like, when we have operational control, we call it scope 1 because we're like, it is our company facilities and it is our direct emissions of operating those facilities. Yes, yes, yeah. And generally, like, I think least when we talk about a property we're not including is like, HR has offices downtown in Salt Lake City. We don't include those, but like our health centers, and you saw kind of that list on the side, a lot of them, we have operational control. We are the entire building. And so, yeah, we include those emissions. But not a problem. And these are like the conversations that when you're talking about, hey, I want somebody to do better, like, it's really important to understand what you were asking them to do, because if they can't do it, that conversation is kind of a non-starter. It's like, if you're asking me to change the ground my house is on, I can't really do that. But if I own the property, if I own facilities, if I have ownership, I can. So it's a conversation. So for carbon accounting software,
Okay.
yeah. So
Are you using any carbon accounting software to manage all this data?
So for our carbon footprint, we use SciMap, and that is approved by the President's Climate Leadership Commitment. So they take SciMap as an official reporting methodology that is kind of a higher ed based methodology, where you're putting in your direct electricity usage, you're putting in your direct fuel usage, et cetera, and then it is coming up with a carbon footprint. They use greenhouse gas, or sorry. Thank you. Yes. Okay. So again, I wanted to emphasize this because we are including that air travel commuting. Like, it is really important to us that healthcare professionals, staff on campus, researchers are able to travel to do research. You know, Logan talked about going to Antarctica twice. That has carbon emissions related to it. And you don't want to tell somebody, no, you can never go to Antarctica and do research. That would be pivotal and probably help you get there in the end. So we say carbon neutral because we want to reduce our emissions as much as possible. We need to see what's left, and then offsets is part of that conversation. We aren't there yet, but I want that to be kind of top of mind when we think about how we have these conversations. Again, what are you asking somebody to do, and how do you think about the steps in the long term? With that in mind, we use carbon neutral and net zero as the widely accepted terms here. Zero emissions, or saying carbon zero, is like, I never emitted anything in the first place. And then at that point, you're probably not talking about commuting. You're probably not talking about air travel. And if you've cut those out of the conversation, like, how can you help people make better choices if you aren't even looking at them? So I'm going to advise, when you have these conversations with other people, think about what role commuting has to play and what role your institutions can help support better commuting options or public transportation availability. Okay. So with that, our path to carbon neutral is not always a straight path. So you can even see we start here on 2020 on this graph, and our land travel jumps up. After 2020, why would our land travel jump up? People stopped doing virtual classes and telemedicine, there's less pressing of a need. So our emissions got really good in 2020 when you look at land travel. People didn't have to commute as much. Since then, there's a bigger return to campus, there's a bigger return to office, land travel emissions go up. When we talk about our strategy, we're looking at right sizing our systems, we're looking at sourcing renewables, and then there is offsets as part of it. We're going to talk through each of those portions here. And with that, I'm going to pass it to Robert to talk a little bit about the UHealth side.
Okay. Yeah, so we're going to talk a little bit here about finding advocates, getting funding and support, and setting a direction. And I wanted to take a moment here and just kind of, state that, like, the main campus and the medical campus they're historically, they've been like separate worlds, right? Where the purse strings are controlled by different people. They have different administrators. And to be honest, they haven't really had much to do with each other. And when I first came to work for the healthcare system, it was kind of an arrangement where, you guys stay out of our business and we'll stay out of yours. And so we thought it would be helpful to kind of, for me to share like my journey from when I first got to the healthcare system, trying to find out how to get this sustainability ball rolling up there, where, folks on the main campus side, they had a hard time really breaking into that world and like trying to influence them because they didn't feel very welcome there, and so I graduated in 2014 with my sustainability degree. When I couldn't find a job, I just decided to go, to work as a general maintenance worker at the hospital for a while I just, took a break from the submitting applications and everything. And while I was there, one of the first things that they taught me was, okay, when you take out, my job was to change light bulbs. When you take out this 90-watt halogen, you go to the storeroom and they give you one exactly the same and you put it back in there, right? And I asked the storeroom, like, don't you guys have any like LEDs that I could maybe use a version of this? And they said, yeah, we do, but they cost more money. We don't really stock them too much. They're not really used around here. Not many people ask for them. So I was like, give me one, let me just go test it, you know? It turned out that the box said it was 12 watts and it provided better light and nobody complained about it. And it worked just fine in the place of a 90-watt halogen. And so that was kind of my very first thought of like, you know, maybe we can change the way that we're doing things around here. You know, I took that idea and I said, well, what about, you know, all of these other type of fixtures that have the 4-foot LED tubes in them? Sure enough, you know, when I researched it, I found out that there's an LED version of that that uses, instead of the 32 watts that we're using, you know, in the fluorescent lamps, the LED version is 12 watts. And so I'm like, okay, I have to go talk to somebody about this. And then I started asking my managers, you know, with this idea that we could probably save a lot of money when you consider that there's thousands of these bulbs all over the buildings. And my manager said, yeah, sustainability people, we've never heard of that here, you know, like we don't know who you would talk to. And so I kind of felt discouraged. Yes,
Hey, Tracy,
what's that?
sorry, is this 2016?
This was about 2014, 2015. Yeah. So anyway, eventually I had a coworker approach me and said, I heard that you've been wondering who you can talk to about sustainability. And she gave me an email from somebody. And I, you know, when I contacted this person, she was somebody important. She was a doctor and she was kind of the unofficial, you know, champion on the healthcare side for sustainability. And she said, yes, there's somebody that you need to talk to. Go talk to, you know, Dan Lundergan, who is the executive officer of Service Lines, and he will be able to point you in the right direction. And I thought to myself, am I going to get myself fired here when my bosses, you know that I'm going behind their back to talk to, you know, the head honcho? And I almost talked myself out of it, but I just got my courage together and I went in and I talked to him and I presented the financial case to him and I said, you know what, like we can save a lot of money on utilities, right? And in healthcare, if you can save $1 on utilities, it's worth $20 to the chief medical officer because you don't have to tie up that money in a budget for the entire year on utilities that you might not pay, you know, until the second half of the year. They can dump it right into healthcare immediately. And so you know, this guy, this head honcho guy, he said, yes, like we need to have this happen at our hospital. We're late to the party on this. Go get with your director. I'm going to tell him that I talked with you and I want you to go champion this and make this happen. And so, you know, I went and talked to the one thing I want to point out here, it was very useful for me to have this, you know, executive director of Service Lines already be bought in and like he understood why we needed to do this, right? Just having that guy on board probably is the reason that I was able to do anything that I did, right? Because I went and I talked with my director. He created the position, our very first actual paid sustainability full-time position in the hospitals and clinics. And yeah, that's when we you know really started the ball rolling. And my director said to me, I want you, the very first thing I want you to do now is go, you know, to the folks on main campus and get connected with them and you know, share ideas, make those connections. And then the other thing I want you to do is to go around and talk to all of the facility managers, right? And just tell them, you know, this is kind of a new thing we're doing, find out what the baseline is, like what kind of systems do they have in their building that we could possibly improve on, right? So yeah, that was kind of my introduction, you know, and to sustainability. Another thing that I did early on is I needed to find out about the incentives for lighting. And so I called, you know, the folks at Rocky Mountain Power, and they said, oh, by the way, you should really get connected with, you know, this other division that we have where these engineers will come into your building for free and, you know, identify opportunities. You can walk around the machine rooms and we can show you how, you know, to, what opportunities there might be for energy savings. But how long do we have, by the way? We're good? Okay. So, yeah. What was it? Oh, okay. So at that point, you know, we finally got some budget, a very modest amount of budget that was dedicated for lighting projects. And I started doing lighting projects. And then, you know, things, when we were dealing with the main campus counterparts, we worked together on a metering project, you know, because you're not really realizing your savings on an energy project if you have broken meters, right? So that was another issue that we kind of worked through together as we had to get the data actually accurate so that we could actually see how much energy savings we were gaining. And you know, these early connections that I made, I was just doing them because my director told me to do them, right? But I had no idea how important they would end up being. They both have turned into like a big deal, like, you know, where we used to do things like small time and now we're kind of like really generating a lot of momentum and doing a lot larger scale projects. Another thing that we did is we created a green team. There had been green teams in our hospital system in the past that had kind of fizzled out. But yeah, we collected a pretty good group, you know, about 24 people to begin with, of folks that really just you know, these are the healthcare professionals that you talked about, a lot of them, and they were coming from their units, you know, to be a part of this effort, and they were really excited, you know, to see this work happening. And yeah, like one of the jobs that I do with energy projects is I go into units and I have to say, okay, you know, I'm counting your lights. They all are like, what are you doing walking around, you know, these patient rooms like a creep? But I have to count their lights. And when they find out that there's possibly an energy project and we're going to upgrade their lighting, they're like, they're really encouraged by this. And they're like, you know, they like it that we're improving the aesthetics, but they're also surprisingly very passionate about, oh, yes, we need to save energy, you know, like this is great, our unit, and they feel like they're a part of something and that they can actually provide me, you know, feedback and say, oh, well, maybe we could do this as well, you know. And so there's the healthcare folks are very, I mean, they are laser focused on what they're doing, and they typically don't want to be bothered very often with these type of things, but I've never had a problem bothering them about anything when they find out what kind of energy work that I'm doing, you know, in their spaces. So, how are we going? Okay, so now I want to just talk about right sizing, right? Like I've kind of shared with you my story. How does a healthcare unit like form a sustainability program, that works for them. And, there's so many variables, there's so many leadership variables and, you know, possible hurdles that you have to jump through. But, in the end, it really helped us to have these people from, the director on down that were supportive. The actual operations staff, the maintenance guys, they were a little bit harder to relate with because they all looked at me and said, you know, as a potential person that's going to complicate their job, right? And make things harder for them. But when, right, when I guess you eventually just like try to like do things the way that they want them done, but then, you're also pressing for these different ideas. And once they find out that you're really on their side and you're not there to like point out where they're doing things wrong, I think most of your maintenance staff will kind of buy in and help you do what you want to accomplish. Sourcing renewables. Yeah, so there's really kind of a three-pronged approach, and there's a saying that we like to pass around our group that you have to eat your energy efficiency greens before you can have your renewables dessert, right? And so Liz's staff has always been, they're engaged very much in the procurement of these, and I'm going to let her talk more about, the renewables contracts that they have. But yeah, like our buildings we have buildings that are like from the 60s, right? That like if they haven't been maintained and if we haven't updated them, they need to come up to a certain level of efficiency, right? Or else all of the renewables in the world are not going to help those kind of buildings. And then offsets, I'm going to let you talk a little bit more about that. So what I want to do actually is just kind of in the area of interest of time, I want to show you examples of some of these projects that we have going on. First of all, the lighting, LED upgrades. We are just kind of going through building by building, unit by unit. We're able to actually use retrofit kits, that look like a brand new troffer. And that way we don't have to change out the old fixture and be very disruptive to the medical staff. But I mean, you can kind of see an example here. This is an actual energy usage of one of our buildings that, was retrofitted over a period of about a year and a half. The difference that can be made energy consumption wise. And then the other even more low hanging fruit is in our HVAC systems. And, what we're going in and doing is we're just making it so we're not, you would be amazed at how much inefficiency is built into even a building as modern as 2014, right? This building came online in 2014, and we found out that there was so much inefficiency built into it that all we needed to do was come in and apply smarter programming to the building control system, and the way that it communicates with the boxes that are above the ceiling. And we realized about a 40% energy reduction by just reprogramming that system to be smarter. And this is the last slide that I have. This is an energy management dashboard, which we put in place to kind of lock in these energy project savings over time, right? Once we have the programming done, then this dashboard will kind of alert us, like if things are drifting away from optimum performance, and we can bring it back to optimum performance. So, and with that, I'm going to pass it back to Lisa.
So the talking through of how we get there, we want to reduce as much energy we're using as possible. So then when we go and source renewables, we're not buying extra to just waste. Like the least sustainable thing you can do is just waste. So first part of sourcing renewables, one is infrastructure planning. So we have a campus emissions reduction study that we are kicking off right now, and we're looking at our centralized infrastructure specifically for heating and cooling campus buildings. We have a cogen plant where we produce electricity, and then we produce hot water, and then we heat those buildings with that hot water. To heat water to very, very high degrees, or a steam plant, for example, if you've heard about that in building operations, you're using natural gas. So if we want to think about how are we sourcing renewables, do we still want to use natural gas and a hot water? Do we want to move those buildings to electric? But looking at what you're expecting out of your infrastructure and what those long-term plans are is really, really important. Because we are talking about, we have aging infrastructure, we have pipes that are going to need to be replaced. What does the future look like for moving to maybe smaller district systems, sharing energy between buildings, heat pump systems, et cetera? And then so for that power that is left, we use power purchase agreements on campus. There are virtual power purchase agreements. Universities on the East Coast use that to then invest in projects. A Massachusetts university might invest in a North Carolina wind farm. We use physical power purchase agreements at the University of Utah, where our power is on the Rocky Mountain Power Grid. So we have a solar project in Huntington, Utah, as well as we have invested in a Soda Lake geothermal plant in Nevada that are on our Rocky Mountain Power Grid with a contract to them. And we are saying, hey, that power that is coming onto your grid is reducing the need for a local coal power plant to turn online. So we can experience those benefits more locally. As well, there's a co-benefit of there's not as much price volatility. You know, to operate solar or to operate geothermal, you're not really dependent on the price of natural gas or the price of coal. So in terms of the university's long-term cost projections, you're able to say, hey, I know what electricity is going to cost you for the next 25 years. So finding those co-benefits when you're talking to your leadership are really important. Another point of power purchase agreements that goes well with what Logan mentioned earlier, Rocky Mountain Power said, hey, we're going to get really green really fast. And that would have met a lot of our commitments. Things change. When you have a 25-year contract in place, you're less susceptible to that change. So, you know, we've talked about the role of power purchase agreements on campus, and hearing Rocky Mountain Power start backing off of their plans tells us, hey, do we want more of these power purchase agreements? And you can see our change in percentage of renewables purchased electricity, 2013 to 2018. It looks steady because the change is so small. Those are on-campus solar installations. And then we also have some power through hydropower up in the Pacific Northwest through a government program called WAPA. If you see these big jumps that happened starting in 2019, those are power purchase agreements. That is one of our two. Castle Solar comes online within the next month, and then you'll see our percentage renewables jump up again. But point being, it's sometimes the not fun contract things that then help incentivize green actions. Last one that I want to call out is renewable natural gas. And this is the unfun thing that I'm speaking to today. Our calculations for our carbon footprint don't really benefit you that much if you use renewable natural gas. They consider natural gas is still natural gas. It's been burned. You lose some of them, but you don't lose all of them. That has made it easier for us on campus to say, hey, we're not going to consider renewable natural gas as part of our solution. If you want to talk about why not, my personal beliefs on renewable natural gas, happy to do that afterwards. But it is why I call out these commitments, because when you're asking people to do things, it's really easy in a leadership position to just say, well, I'm just going to buy renewable electricity. Why would I care about energy efficiency? Or I'm just going to buy renewable natural gas. Why would I care about moving away from gas? Or I'm just going to buy biofuels. Why do I care about moving away from diesel? Those are really rough conversations to be in. And you can lean on a commitment to say, hey, that's not actually going to work the way you think it is. Like, A, it's not going to benefit the climate, but B, you're also still going to fail your commitment if you do those things. So I want to point that out as you have these conversations. Those loopholes exist, and you should know your commitment to make sure people can't use those loopholes. just thinking long-term. Similarly, offsets. If you want to influence air travel, if you want to influence, commuting, you should think about those Scope 3 emissions, but then offsets is part of it. That is down the road for us, to be honest. The offset market is not super regulated. It doesn't look great. California has more ambitious commitments that they are going to start to set what the offset market looks like right now. How we talk about it with our leadership is saying, hey, we want to reduce the amount of offsets because just paying for something in perpetuity is not very financially responsible and it's not very sustainable. So we use it as a little bit more leverage saying, let's reduce our footprint as much as possible. So then you don't have to buy these offsets in the future. And it's a way to say, hey, if you're going to be carbon neutral by 2040, doing so, if you have to buy a bunch of offsets, then isn't going to be fun and is going to cost a lot of money. So let's do the work now to avoid that down the road. So it's also an important part of that conversation when you talk to leadership of saying, hey, make the investment now to save yourself in the future. So the last thing we want to talk about was how do you start? And I get to pass.
And I
back
think
to-
we just got a few seconds or a minute.
Well,
or
this is our
so.
last slide.
Yeah, this is just, a couple of very great websites and resources that have helped us, get started. And, they take you step by step. How do you identify your strengths and weaknesses and, start a sustainability program in your healthcare organization? So. But yeah, I guess the last thing that I'll just wrap up with is we have Alyssa's organization, their department is like really beefed up. Now we actually on our medical side, we have a director in operations and we have a director on the medical side. And yeah, this thing is really just kind of building. And we're so happy that we have the leadership that we do at the very top levels that allow this to happen. And, I think that the work that all of you folks do is very helpful to, create those leadership positions that are so important to driving this work in healthcare.
Thank you so much for your time and for presenting this experience. And it's, to me, from out of state, it's wonderful to see what's happening here in Utah on multiple fronts about becoming more sustainable and decarbonizing. I don't know if you're available in the back for just a few minutes if somebody has any questions. And if anybody's interested in knowing how an economy-wide price on carbon might affect Scope 3 emissions, you can come talk to me afterwards too. Thanks so much.